Well, I'm Bob Wiggins. Thank you, everybody, for coming today. It's really my great pleasure. We're going to be talking today about a company called Equitek and the founder, Gaston Bushiri. I've had the pleasure of working with Gaston now for about a year as an engaged client of Red One Ventures, and I'm really excited about what you're working on, and I think our group here today is going to be excited as well. What Equitek is a platform as a service that addresses what is really almost a crisis. In fact, maybe it is a crisis in the healthcare world, which is the staffing and scheduling challenges that hospitals and other medical facilities face. It's a very serious problem, and Equitek and Gaston have come up with a very creative and interesting solution to that. So Gaston has 20 years of experience in the healthcare operations and finance world, which is odd because looking at him, did you start at age 8? Yeah, 20 years of experience. He's currently the VP of Finance for the Ohio Health Grant Medical Center and also the Berger Hospital and Oblentis. That's one I cannot pronounce. Oblentis Hospital. So 3 hospitals in the Ohio Health System. And the genesis for Equitek was Gaston's experience in the industry and seeing the critical issues that we have with respect to staffing. So with that, please welcome Gaston.
Welcome.
So you all may have been to earlier iterations of this event, but what we'll do is for about 45 minutes, I will ask Gaston some questions. And then to the extent that I have not satisfied your expectations from an MC, which is likely, you'll have some time to ask Gaston some better, more probing questions. So I guess maybe just to get us started here, Gaston, why don't we take a couple minutes and just give the elevator pitch for Equitek? Tell us the story.
Absolutely. Right? Sure. So Equitek is essentially an on-demand marketplace that is addressing the healthcare staffing as well as scheduling challenges that the industry face nationwide. And so using our proprietary artificial intelligence as well as machine learning technologies, we're essentially matching the clinicians with facilities directly. As a result, we're ultimately going to reduce the overall labor cost associated with premium pay, and ultimately improve the lives of healthcare professionals. And finally, our ultimate goal for Equitek is also to improve the patient care.
Yeah, it's a big goal, but it's an important goal. Just a follow-up on that, I mean, you know what's going on now in the industry. How is what you're doing different from the current approach that the hospitals use with respect to staffing agencies and the like? They're doing something now, but you're doing something significantly different. Maybe talk about that for a minute.
Yeah, absolutely. And so, I'll talk to you a little bit about just the segmentation of the healthcare staffing industry. The healthcare staffing industry has a traditional staffing agency that we all know about, the likes of AMN and across countries of the world. And then you have the emerging market, right? The emerging solutions that have used some of the on-demand marketplace to address this issue. But your traditional or your typical hospital also has their own solutions in-house that they're using to solve this problem, which is to partner with your traditional staffing agency. What we're doing that is different is really to not only build an on-demand marketplace, but to really help hospitals regain control of the staffing challenges. So essentially giving them this control tower where they have visibility, because typically your traditional staffing or your typical hospital would have visibility to just the 4 walls or within the 4 walls of a hospital health system. But with our platform, we're giving them visibility and control to the market, not only locally, but also nationwide.
Well, it's really, at least from our research, a unique approach to this, and at least early feedback has been very positive. So you're the VP of Finance at 3 hospitals.
That's correct.
And that's I imagine, a full-time job.
It is.
In fact, might be even more than a full-time job. Yet somehow you're also starting a new business, running it, getting things going. How do you juggle those two things as well as having a family and everything else that goes along with life?
Yeah, that's an interesting question, a tough one. But I tell you, for me, this isn't really my first rodeo. I've always juggled multiple projects at a time, and I'll tell you the story. About 10 years ago, I was pursuing my MBA and MHA at Georgia State University in Atlanta, Georgia. And during that time, it was a 20-month long program. And during that time, I had 3 kids. We had 3 kids. We had 2 girls and the youngest one. And I was working for Kaiser Permanente at the time, the medical group, full-time. And I also started a small tax preparation and accounting firm. And so I always multitask and handle multiple projects at a time. And I think what's different now is that I am further along in my career. I have more responsibilities and I have more visibilities. And I've learned from my mistakes when I started other businesses where I failed. And so the stakes are higher for me. And so the challenge really is to be meticulous and not commingle my personal life, my work, and the business. And so the way I do that is really just being able to really plan ahead of time. And I'll give you a perfect example is when it comes to this business, I burn the midnight oil, but what I tend to do is to really make sure that I'm not burning the midnight oil, I'm not working until midnight when I have a critical project or I have a deadline. So in my line of business, as a VP of Finance, I have a monthly or recurring meetings the first 5 to 7 days of the month, and so I try to dedicate my attention or spend most of my time focusing on my full-time job, and then focusing on weekends to work on the business or in the evenings. And as it relates to family, I'm really trying to carve out a time to spend with my family. So that's how I'm managing between my full-time job, my family, and the business.
Well, I think a lot of the people in the room and a lot of the entrepreneurs we work with at the stage you're at have the same challenge. It's hard. I think you probably get a lot of empathy from the room for trying to do 3 things really, really well, and you have to do all really, really well at this point. So what's one of the hardest things that you've had to deal with so far on the journey? I can assure you there will be many more hard ones, but what's been hard so far?
So for me, I'll say maybe 3 things that have been hardest for me. One is really raising capital. It's your typical chicken and egg problem where you want to raise capital, right? You go to investors or potential investors, but the majority of most investors will ask, well, do you have a prototype? Do you have a product or an MVP? And but you can't have an MVP without the funding. And so in our case, with my partners, like the founders, we did spend some money to develop a wireframe, but again, it was a mobile application wireframe. It wasn't a fully functional mobile application. And so that's been extremely challenging. But I think the market, the pandemic has really done the work for us, where initially when we first started, it was extremely challenging, but as this problem became front and center in the market, it really validated our product or our services. And so that's essentially how that's one of the challenges. The second challenge really is building or assembling a team. It's a similar problem as the chicken and egg, right? Because we want to build a team. In fact, we did identify a software development team that was ready to go jump on board and help us develop the MVP. However, these are freelancers, and you got to pay them. And so if you don't have the money, you can't really pay them. And so that's one of the challenges that we also face. The other challenge is really time. One of the hardest things, and I think it's a good connection to managing more multitasking, managing the job and the project, which is it's extremely time consuming. I can't remember how many midnight, how many times I've been up until midnight, 1 o'clock in the morning, or how many times I've been working in my office at home and my girls knock on the window or the door and say, hey, can we go play basketball? And so I think time has been extremely challenging, but they've managed to.
Well, I think that first one, you identified the challenge of matching the needs for funds with the availability of funds when you haven't gotten to certain milestones. That is a problem that I think probably everyone in the room and everyone within 3,000 miles of the room feels. I will say, I think you all have done an amazing job of hitting milestones without money. And I mean, you did manage to get the team working on the MVP. Utilized the Rev1 resources extremely effectively, which I applaud you for, in terms of getting help from like Tim Steele, who is here today, and some other. There he is, right there, Tim Steele, ladies and gentlemen. And you know, you've managed to do a lot without very much, and that's what you have to do. So, when and how did you figure out that this problem that you're addressing is a serious problem in the industry? I mean, was it just obvious, or did a light go off one day that, oh my, you know, we've got to do something? And how did you fit that with the vision of the product? How did it come together?
Absolutely. So, as like I mentioned, I've been in the industry for over 17 years, 20 years of working. So I think it was gradual, right? So I started off as a staff accountant or senior staff accountant in the healthcare industry, working at a hospital. And as I was moving on to my, moving along or finding the corporate ladder, this was a recurring theme. It was a problem that kept recurring, right? During the budget season or during strategic planning, where staffing and scheduling were always a problem. And so over the years, I've always wondered, well, why can't we solve this problem, right? And so we land of the year, we have a budget, and there are times during the year where we exceed our budget because the premium paid for the staffing challenges. And so when the pandemic started, and I'm going to go off on a tangent here a little bit to tell you what was the impetus of really focusing on this project. About 8 years ago, I had a similar epiphany about a business that I wanted to start. And many of you know Instacart. And so at the time, back in 2014, I was, went to the drawing board and I wanted to address the shopping industry and went to the grocery shopping. And so I started designing this app, but then I got cold feet. And then, fast forward here, many years later, Instacart was, at the time, Instacart was only 2 years old. It was one of the competitors that I identified. And then Instacart was probably, I believe it went public. And so Instacart was worth billions. And so when the pandemic started, I went back and I had ample time. That was when I was really transitioning from Atlanta when I took on the job here at Ohio Hub in 2019. My family was still in Atlanta, and I was here in Columbus. I was traveling back and forth, and I had an apartment. I had plenty of time. And so when the COVID started, I did anticipate that this staffing challenge problem that the pandemic would exacerbate this problem. So I went back to the drawing board and started just brainstorming, how can I solve this problem? Because I did anticipate that this would be front and center. And so that's really how this idea came about, where I went back and said, okay, if I were to solve this problem, and I know this the pandemic would exacerbate the staffing challenges and scheduling challenges, how would I solve the problem? So that's essentially how we did it.
So since you're living with the problem, you perceived the problem, obviously, and then said, what would work in our situation to address this problem?
Correct.
And I don't know, I think everybody in the room knows this, but this is a gargantuan problem. My sister-in-law in Portland is a nurse. They're on strike right now. And they're on strike mostly because of this issue. It is a big deal.
It is a big deal, and quite frankly, just a quick anecdote. And I don't know if any of you have seen this on the news. The staffing agencies' costs or prices have tripled, at times quadrupled, over the past 2 years. It's all over the news. It is a serious problem. Every hospital, there's not a single hospital in the States that's not facing this problem.
Sorry. probably haven't heard anything we said. All right, let's start over again. I'm Bob. We were also yeah, we'll do a better job of talking loud. So, I maybe just riffing a little bit on that point, though. Talk for a minute about the work you did with Tim to try to get feedback from other market participants, because I think that's instructive to how this process is to go.
Absolutely. So with Team, we're partner on a voice of the customer, and but I'm going to step back a little bit. During the customer learning lab last summer, I had to conduct my own formal voice of the customer exercise, and reached out to a number of healthcare executives. Didn't receive the type of success that I've seen with Team, because that's what he does with a living. And so back then I did have some feedback as to how serious this problem was. But really partnering with Team, we've met about 6 or 7, going on in 8 of some of the health systems, and mainly one in Massachusetts, which is Covenant Health. And their CEO is really eager to hear more about the business or the proposition, because it is a problem that they're experiencing on a daily basis. They have experienced in the past, and they will experience in the foreseeable future. So it is a consistent problem. But we interviewed a number of those executives, from the CEO to the chief nursing officers to even some of the directors in human resources and in staffing, and the all really validated the need for this service or the product that we offer. It is a pervasive problem. Again, like I said, there's not a single hospital in this country that is not facing this problem.
So, been doing this for a while. Got a long ways to go, but been doing this for a while. So, what did you wish you would have known when you started this process that you now know, and boy, gosh, I would have known that from the beginning?
Right. I think what I wish I would have known is really the resources that are available for entrepreneurs. And I'll go back. I'll give you an example. Is a good analogy. Is when I was studying for the CPA exam years ago, I went about it. I went to Barnes and Noble and purchased a book that's about 3 inches thick and self-studied the CPA exam. And obviously, I didn't do well, right? So I passed about 1 part and 1 out of 4. And then through research, I found out about Becker review course. It's a really a prep course. And I tell you, when I went back, it was mind-boggling how many resources they had available, how they prepped you for the exam. They really taught CPA exam takers how to pass the exam. And I say that to say, what I wish I had known is the resources that the business incubator and accelerators have available to entrepreneurs like myself. I wish I would have known it sooner, and so that's one thing that I wish I would have known.
Huh. I wonder if there's any organizations in the area that provide such services. Yeah, like Rev One Ventures. Oh, yeah, you're right. Rev One Ventures does that.
And just to add another comment on that, I mean, the resources, such as the customer learning lab, I mean, those resources are really built for entrepreneurs. They literally walk you through the processes. And I think I was, for lack of better terms, kind of winging it when I first started. But I think with Rev One, it really kind of helped me narrow down what my path is. They really help entrepreneurs decide whether this is a good idea, how to validate the business, how to validate your value proposition, and really when to pivot, and also when you should quit. And so luckily for us, we were able to validate the business, we were able to continue. But those are just tremendous resources that I think I wish I would have known earlier in the process.
Well, I will say, I've seen a lot of driven entrepreneurs, and you're in the top decile. You want to make this happen, and that doesn't guarantee that it will happen. But if you don't have that drive, it pretty much guarantees that it won't. So, you had a couple of big ideas before that you wanted to do and didn't happen. This one big idea is happening. What do you tell how can you advise people on the kind of the big issue of fishing and cutting bait? You know, how do you know when it's something you don't give up on, because you can't give up because you have to do it, versus I could do this for the next 10 years and it would be really stupid? Is there a way to tell that those two apart?
Well, you know, like I said earlier, for me, I'm lucky because this is a problem that I've faced, right? I've faced over a decade, and I'll continue to face on a daily basis and in the foreseeable future. And so what I would advise an entrepreneur is really just do your due diligence early on, and really seek advice, seek legal, whether, or other professional advice, just to kind of help guide you. And so when I first started, one of the things that I did right off the bat is I hired or engaged a law firm. I engaged a regular law firm locally, and one of the reasons I didn't realize how reputable and how expensive they were, because I was new to Columbus, but I was lucky because I knew one of the partners, and through that partnership I was able to reduce my costs. But you know, it's really seeking that advice, legal advice on starting the organization, what business structure you should have, and really drafting that operating agreement from the beginning. But also as part of the due diligence, really researching the market, really having a good grasp of what is the problem that you're solving. And in my case, I experienced this on a daily basis, but I had to go back to the drawing board and really try to punch holes in what the value proposition. Am I really offering a solution that potential buyers are willing to buy? And so again, just that due diligence, and the right business structure, validating the idea, and also building the right team and the right partners. And I have to admit that I was a bit strategic when I first started. I was new to Columbus, and so I partnered with one of my partners who was a market president at the time with my employers. And the reason I partnered with him is because I wanted to leverage that his political capital within the organization. And as a result, we were able to partner with Ohio Health and submit our innovation proposal through the new venture and business incubator within Ohio Health, which ultimately connected us with Red One Ventures. And so I really think that it's having a plan, following that plan, and executing on the plan.
So this is going to be my last question, and then we're going to let you all ask better, more probing and thoughtful questions. In terms of the motivation, and I want to ask this to a lot of entrepreneurs, is it just an obsession, this is something I have to do? Is it the money? Is it I've got to build something, it's in my head and it won't go away? What is it that makes you want to do this?
Well, I am an operator at heart. For those of you, if you work in the healthcare industry or in the hospital, having a finance background, you always put in a box that you're finance. But being an operator or being a finance expert in healthcare and really understanding operations is detrimental to making sure that a hospital stays financially viable. And so I've always wanted to be involved and understand the operation of a hospital. And over the years, I've identified this as a serious problem. And so I honestly and genuinely want to fix this problem, or I want to help at the minimum. And so that's really been my driver, because ultimately, when you're in healthcare, when you get into healthcare, it's really about the patient, right? And so this is not just about money. It's not just about the work-life balance of healthcare professionals. It is ultimately to improve the patient care. If the staffing is not right, the outcome may be detrimental for the patient's lives. And so what drives me is really ultimately is to not only improve the work-life balance of a healthcare professional, reduce costs, but it's ultimately how do we improve the patient care or patient outcome. So that's really my drive. I think the money and the fame or what have you, it's secondary. And this is really what drives me.
Yeah, I think that's actually, if you ask most entrepreneurs, that's what they would say. Other than money long time to get the money and fame, and the other, you get more gratification as you go. Well, we're gonna open it up to the room a little bit here. So how, actually, how do you want, are you gonna be the mic bearer? And maybe they'll do better on the mic than we have. So who has a question for Gaston? Right there.
I have two, if you don't mind.
Sure.
The first is, are you planning to have this going out as a subscription model?
Yes, it is a
Okay.
software, it's a subscription model. There is a, so I'll tell you a little bit about our revenue model. So we have a staffing platform as a service, or a subscription model, it's a SaaS, but we also have a placement fee on top of that. But 80% of our revenue model, or revenue generation, will really be a SaaS or subscription.
Oh, that's secondly, it was interesting to hear you say that like Andy Lozier's team helped connect you with Rev 1. That's great. Have you found it more or less difficult, and maybe you are, embedded in Ohio Health? Are they using your platform? And if so, or if not, have you found it a benefit or a detriment to have a sponsor utilize, or your hospital or its sponsors you utilizing your tool?
So, Ohio isn't using my tool yet. They're aware of it. They've studied it, validated it. I think the benefit of Ohio Health really is it's just, they're a big player in the market, right? And so it was really beneficial to us to have that referral, right? That referral from Ohio Health to the direct venture. I think the detriment really is that Ohio Health is big, right? And they don't necessarily jump on an idea or a concept until they've seen some type of traction. And so that's been the detriment. We really want to see some of the traction, and I think that's why I'm partnering with Team and Rev One to really begin to build that traction so that ultimately we'll go back to Ohio Health so that we can pilot to those customers. Can I answer your question?
Jeff Farrenholtz, the City of Columbus. You seem like you were from Georgia previously and Atlanta specifically, is that correct?
Yes.
How would you compare the network of people here in Columbus versus the people for entrepreneurs in Atlanta? Is it just Atlanta so big you might not be able to connect with anyone, or is Columbus the right size, or what's your view on that?
That is an excellent question, and quite frankly, I'm excited that I'm in Columbus, that I am committed to spending a while in Columbus. But just to your point, Atlanta is so big, it's so large, and the network is so big. The main network that I had was really through my school as an alum, because a lot of those alums had key positions throughout the city, but it was limited. But to your point, Atlanta is extremely large, and I think Columbus is just about the right size. It's easier for me to move around. It's easier for me to network within Columbus than it would be in Atlanta.
Wonderful, thank you.
Gaston, thanks so much for the insight, and I'm from Atlanta, so I can talk a little bit more about that. Quick question: as a founder of Color, and also being from Africa, what were some of your perspectives of getting into this industry, the network, of how you're very strategic in doing that, but also your morals and your values of what drove you to not be perceived as someone as less than in this particular space, especially in the healthcare space, but also as a founder of color, both being Columbus in the Midwest, but also globally. And second of all, how is your product having an impact globally? There's a benchmark in terms of what's happening on a global basis compared to what's happening on the domestic side in terms of your product. I'm just curious on that. Millennials have a whole different mindset of healthcare and the convenience that's happening right now. So if you can answer those two questions for me,
Sure. And so, in terms of my background, and I tell you, I think it's been a benefit. I graduated from the African American Leadership Academy here in Columbus last year, and it's really opened my eyes. As an entrepreneur of color and coming from Africa, I didn't really face some of the challenges that I'm facing in the U.S. And so it it was a different perspective. I was oblivious to it, right? And so I've learned over time, and I've really forced or encouraged myself to really understand the culture and some of the barriers that founders of color are facing in the country, and also looking for allies, right? There's always a potential, there will always be a percentage of people who will not support founders of colors, but the vast majority of people will. And it's really looking for those people who are supportive, who can be your ally. And really learning from my background, the values that I was brought up with. My mother, and I'll tell you, when I came to the States, I came to the States at the age of 18. When I went to college, what my mother told me was, go out there, your education is your father and your mother, right? And so that's what I pursued. I pursued my education. I wanted to be the best at whatever I did. I pursued every single accolade that I could have gotten in my field. And so that's really how I approached being an entrepreneur of color. It's really looking for allies. And again, Columbus is a great, and like I said, I'm really happy to be here. And not to say that Atlanta does not have support for the town of allies, but I think Ohio Health in itself is one of the reasons why I'm here, because Ohio Health was seeking a leader in my role of color to fill that role, and so I'm lucky to be here. And so, using an organization such as Ohio Health as an ally is definitely tremendous. In terms of this product, you mentioned the new generation gig economy.
Yeah.
This is exactly what they need. The new nurses who are graduating from college or from nursing school, they want flexibility. They want a work-life balance. And the scheduling, and that's why the scheduling has been a problem. It's been a challenging industry because we just have not been as flexible in the past. And so this product gives them that flexibility where they can work when they want to work and where they want to work. And we've seen that, and the healthcare industry hasn't always been open to this idea of the gig economy. And over the past 5 years, including the pandemic, especially during the pandemic period, they've really opened the eyes and being accepting of this, the gig economy and being flexible with scheduling.
Great, thank you.
But I think it even goes a little bit beyond that, because today they do use staffing agencies to get traveling nurses, but the economic case that your company provides is far more appealing, I think, to both the nurse and to the hospital. There's more money to the nurse, less expense to the hospital, and more control over the overall staffing of the hospital. I mean, it is, I don't want to sound like your evangelist, but it is a significant revolutionary change to the business model of dealing with the staffing issue. I mean, the people are dealing with it, but I think that this is going to change some approaches. Other questions?
Hi, everybody. I'm Carla Ashton. What I'm hearing is that the market dictated a need for this change. The nurse changed to wanting flexibility, hours when they need it, want it, etc. Right?
Partially.
Was such a product or solution there before you started?
So yes and no. The market demanded, right? This change, and over the past 5 years, let's say about 5 to 7 years, there have been some new entrant in the market, but that have proposed something somewhat similar. But the difference is that they're still catering to the clinicians, right? It's an on-demand marketplace, but it's the work-life balance of the clinicians. We're going beyond, meaning we're not just focusing on the clinicians, because ultimately the buyers are hospitals. And so we really want to, as an operator at heart, at first, I want to make sure that the hospital is also being served. And that's what we don't have in the market. The market is really not addressing it from an operator's lens, and that's what we do.
So for the hospital, does it ease them operationally as well as financially?
Yes.
Your product?
Yep,
So
absolutely.
there's benefits for the nurses who are basically, that's your product you're selling to the hospital.
Right. So it is free to the nurses. So all the clinicians will sign up on a platform for free. Really, the buyers are the hospitals. And
And how does it save them money? Just
So it's saving money by virtue of the premium fee, because currently, when you hire a staffing agency, there is a premium markup that the staffing agencies are charging the hospitals, and that premium markup at times it could be twice, especially during the pandemic, 3, 4 times what an employed clinician would pay, what a hospital would pay clinicians. And so, and the staffing agency, not only do they have a markup, they have a markup because of that overhead cost. And because we are a software as a service, our overhead cost is not as high as the staffing agency. So we're able to not only save, but pass on those savings to the hospital as well as the clinicians by way of increasing their average hourly pay.
Thank you.
Sorry, then, are there physical firewalls around your client's ecosystem? Meaning, if, again, Ohio Health signs up for this, and I am an employee, and I hear that there's also great opportunity in another city, but that hospital does not have, am I unaware that another hospital's not paying for your product that has an opening?
Yes, there will be physical walls, and so to your point, and the way we overcome that physical wall is really it's reaching that critical mass, right? We have to have as many users as possible sign up to our platform. So yes, so there is a physical wall, and again, so it's speed to market, right? And so that's really how we're going to overcome that. It's really just registering as many clinicians as possible.
So, I mean, if you have Ohio Health, and I'm an Ohio Health nurse, and I will not know of an opportunity over at Mount Carmel.
You wouldn't know of an opportunity in Mount Carmel if Mount Carmel is not on our platform.
That's what I mean, yeah.
But as you know, it is out there. But I think the benefit for us to really mitigate that flaw is that when you go to Mount Carmel, you don't necessarily, you might not get the same rate for the benefit, because remember, our savings, we're passing along our savings to not only the hospital but also to the clinician, because their average hourly rate is increasing. So you might not get the same average hourly rate if you were to go all online.
Thanks.
Is this technology aimed at clinicians who have been travel nurses who like to operate in that travel nurse space, or for somebody who's, I'm in Columbus, I want to stay in Columbus, my family's in Columbus, but I just want more flexibility? Like, how is it what is it aimed at? Who is going to be your end user?
So that's an excellent question. It's actually both, right? So it's not only travelers. If you want to travel, so remember what we talked about, the control tower. So currently, hospitals have visibility to just their local market, right? Within the four walls of that health system. And the only way they have visibility to other talents or people who want to travel outside of that market is to either publish it on Indeed or hire a traditional staffing agency. With our platform, a nurse, you can hire a nurse locally, or you can hire a nurse who is in California who wants to travel to Columbus. So it is addressing or targeting.
I also have a question. I come from a healthcare background in home health and hospice, and I'm sure you probably thought of your market segmentation after the hospital system. Have you considered skilled nursing facilities and home health and hospice as part of your market?
Yes.
Because operationally, I can see, because CMS, Center for Medicare Services, penalizes home health companies and hospice companies, as well as skilled nursing facility operators for readmissions to hospitals. And a lot of times, what is happening is because of the staffing crisis, that there's a trickle-down effect. Hospitals have a staffing problem, home health has a staffing problem, skilled nursing facilities. And then what happens is you're just triaging the care down the road, and people are seriously lacking with the care that they need right now. So it's best to be healthy right now. So if people don't work in healthcare, they don't understand this. What he's addressing right now is a crisis. I mean, it is a flat-out crisis. They're delaying care on patients. They're literally triaging. They're taking the sickest of the sick and saying, we'll take care of you, but you know what? You're going to have to go home. And you're going to have to go home with home health, but then the home health company's like, I can't pick you up. I don't have a nurse. I mean, so it's really that serious. I mean, not only are you looking at it, I would think, from an operational, financial standpoint for the hospital, but I could also see a use case for for skilled nursing facility operators and home health under the operation and compliance with Medicare for the free hospitalization and hospitalizations that they receive.
That is that's a great point, and you're actually about 3 or 5 years ahead of us. And so,
We
what
should
I,
get that quote down.
so what I mean by that is, as part of our go-to-market strategy is we're going to go first with the hospitals, but we have skilled nurse facilities, we have home health, we have dentists, we have dialysis, and so on and so forth. But that's later down the
All of
road.
it fits in here. All of it fits in here.
It's part of our go-to-market strategy.
And definitely not a good time to get sick, so don't. Any other questions?
I have a quick question. Thanks, Gaston, for sharing your story. Christy with Red One, good to see you in person. Is there anything you need help with, any connections that you ask this audience for?
Absolutely, thank you. Yes, so really the connection that we need is really just piloting. We're in the process of developing our MVP, and we should have it by July 31st. And we've got quite a few health system or hospitals that have shown interest in piloting. And so really getting the nurses, if you know anybody who's a nurse or a traveling nurse, to really help us test the MVP, and also health system or hospital that are willing to pilot that so we can put it on MVP.
Are you specifically focusing on just registered nurses? Are you going to look at physical therapists for the hospital system and OTs and things of that nature? Or are you going to specifically, for part of your MVP, are you going to do RNs to begin?
No, we'll do both. We actually, so that's why we've been very careful to say that it's a clinician solution, right? So
I love it.
yeah, so we're addressing clinicians, meaning registered nurse, LPN, and so on, but also other healthcare professionals such as lab techs, and so on and so forth.
It's a lot of it, all of it. Your market segment is huge. It's huge.
It is.
You're
But
huge.
one last question. What about the safety issue in healthcare right now, which is the biggest concern of people not wanting to come in for healthcare, kind of going back to the colleague's point here? Your software may or may not address that, but from an industry standpoint, the country got exposed very badly in terms of not being prepared, but also for nurses now, that pipeline of being in nursing school, medical school, and then also the cultural relevance of understanding. I can't even see my loved one now that's passing. What's the mental health aspect now of having an industry as it relates to the needs of staffing? Because if I have options to work from home or to work in a hospital, work remote, how is that going to be 10, 20 years down the road now? And again, kudos to Rep 1 and the team here that's helping me in that particular space. But give that picture real brief if you can of what the industry is going to look like in 10, 20 years from now, from a safety standpoint, impact that may have on your actual product.
Sure. Safety is key. It's definitely front and center as well. So the way, one of the features that we have in our software is predictive analytics using artificial intelligence. And so, and we will have an API, an interface with our software, with the software and the EMR. And so it's between the software, the EMR, as well as the timekeeping. And so we'll be able to pull the standards, the workload of productivity standards, so we know what is the safe level of staffing that a hospital will need. And so we'll be able to match that with the demand of the nurses that we'll have on our platform, so that we can predictably recommend the right staffing, looking at what is available in the market, and really starting and suggesting what that staffing would look like, whether it's a week from now, or 6 weeks from now, or 120 days from now. The industry, quite frankly, the nursing industry is projected to have a shortage of about 1 million nurses by 2030. This is a problem, again, that's what I meant by, it won't go away. It's a problem that will be in the foreseeable future. And the way this, and there is also a problem that exacerbates this, which is there is a maldistribution of nurses. I guarantee you, as we're speaking now, there are nurses who are on the bench, who are qualified, but are not aware of jobs that are available. And so the more critical mass we have, and the more nurses we have sign up on our platform, we can potentially, using artificial intelligence predictive analytics, really start pinging those nurses who are sitting on the bench and matching them with potential jobs that are out or available or demand, and to really redistribute the supply of nurses and matching the demand. But I'll tell you, the future is, unless there is a new infusion of nurses in the industry, by 2030, there will be a tremendous shortage of nurses. And quite frankly, the industry currently has really been looking at international nurses. And that's something else, that's something that we also consider in the future. How do we partner with international nurses or international schools across the country? And I'm from Africa, and I'll tell you, it's over 1 billion people in Africa, and half of them are under the age of 30. And so there is a potential there to subsidize or supplement the supply of nurses in the U.S. if we can educate them. And I think we have enough time where by 2030, we have about 8 years now, between now and 2030. 4 or 5 years, you can educate a ton of nurses that will be able to supply that demand or supplement it.
Great, thank you.
I'm a lawyer by education, but work in economic development. Who is carrying the liability for any malpractice or anything that is happening? Is it the hospital that's hiring the nurse? Is it you guys acting as the middleman? Is it the clinician themselves? Who's in charge of that liability?
Good question. So it depends. So if it's an independent nurse, as part of the onboarding and the credentialing part, an independent nurse is required to have a liability insurance. But if it is an employed, then the hospital is carrying that liability. We're essentially a platform. We are a pass-through, so there is limited liability other than, when it comes to identity theft or what have you. And so we'll have those built into our platform. But in terms of liability, it depends on the type of the associates. If you are an independent, you must carry the professional liability insurance. If you're employed, the hospital carries the burden.
So you've kind of walled yourself off, hopefully.
Yeah, hopefully. There's always a risk.
That's why they have very good lawyers as well.
Yeah.
Any other questions from the group? Well, I think let's have a nice big round of applause for them.